My name is Ted Burns, and I'm Senior Director of Political Affairs and RADPAC for the American College of Radiology Association, and I want to welcome you to our RADVOCACY podcast hosted by RADPAC. Our goal with the podcast is to give you a behind-the-scenes look into the various advocacy efforts of the college, our members, and insights from political influencers here in Washington, D.C. Hello, today I'm honored to have with us Congresswoman Lori Trahan, a member of the House Energy and Commerce Committee. And welcome. It's been a while since we've talked. We talk on and off as we see each other in DC, but we're really excited to have you join our podcast today.
Yeah, I'm thrilled to be here. Thanks for having me, Ted.
Sure. So if you could tell us a little bit about yourself. You have a pretty unique background, but before we get into that as it relates to Capitol Hill, and I don't want to bury the lead, so I'll just say that. Tell us a little bit about your background, where you grew up, where you went to school, and then kind of how you made your way to DC, and then we'll get into your background on the Hill.
Sure. So I think my family story is one that I think a lot of folks in Massachusetts, especially, families in the Merrimack Valley where I grew up, understand. My grandparents were immigrants. My grandmother came from Brazil. My grandfather was from Portugal. And like so many, they came to the United States in search of a better life. And like a lot of immigrants at that time, they settled down in a mill city along the Merrimack River in Lowell, and they got to work. My grandmother was a mill girl. In one of the textile mills in Lowell, my grandfather was a carpenter, and like a lot of first generation Americans, my parents took a similar path. My dad was a union iron worker. My mom juggled, multiple part-time minimum wage jobs while supporting my three sisters and me. We grew up in a small house, so small that I often had to, fight my sisters to get into the bathroom since all four of us just shared the one that we had. And, our family, we worked for everything we had. I'd wake up before the sun came up and I delivered the newspaper to help my father pack his lunch before he went off to work. And, my parents always impressed upon us education and hard work. Those were two things that we had control over and that we needed to maximize. So, it's interesting, I knew I wanted to go to Georgetown when I was in the 8th grade, but, my family had a pretty sober perspective about the chances of my going to a school like that, because it just wasn't something we could afford. I did get lucky. I was a decent athlete in high school and, able to get an athletic scholarship to go to that school. And that changed the trajectory of my life, which is why now as a representative, I view a lot of what I, do and fight for through that lived experience, and how I wouldn't have had a lot of options if it wasn't for, going to college, using sports to get me to college, working for everything that we have. And I just think there are a lot of folks in my district, across Massachusetts, across the country that are in a similar spot. And it's really important that you have representatives who kind of understand that feeling of living paycheck to paycheck and getting, opportunity and the ability to seize on that opportunity to create a better life for them and their family. And that's one that, I lived, I know it. I know that there are a lot of people who I represent who are doing just that.
So why Georgetown? Why was that like the school?
Yeah, so I thought I was going to be a diplomat. I was going to be in the Foreign Service Officer Corps. Not only did I know I wanted to go to Georgetown, which was situated in Washington D.C., a city I fell in love with, and I wanted to be a diplomat. And so going there, I had my sights set on that very early on. Now, I'm not a diplomat. um, so what happened, I guess, is the obvious question. When I was finishing up at Georgetown, we found out that my dad had multiple sclerosis. And I think my family was going to need a lot of help, was kind of what was going through, sort of my mind. So after graduation, instead of joining the Foreign Service, I moved home to help my mom and dad. And, costs were a big concern at that time, but also the unpredictability of a, disease like MS. I just didn't know, how that was going to impact my family. Look, my dad, fortunately, he had a great insurance through his union, but MS drugs are expensive. It was brutal going through, medication after medication without seeing much benefit for my dad. That experience the difficult conversations that my family had about affording his medicine really shaped my view on the need to make prescription drugs and healthcare in general more affordable and more accessible. Because look, if it wasn't for the benefits negotiated by the union that my dad belonged to, which was the iron workers, I don't really know what my family would have done. There are so many families who are living, just one hospital visit or one diagnosis away from financial ruin, and so that was pretty impactful at a experience at a very impressionable age.
Well, so you go to Georgetown, and in case anyone's wondering, your athletic prowess is volleyball. And so you go to the Hill, or you somehow get into the Hill, and it's not totally uncommon, but it's also not super common either. I mean, there's maybe a handful that I can think of right off the top of my head, but you were actually a Hill staffer, now turn member of Congress. And so kind of talk about that journey, and you knew what you're getting into. Oftentimes we'll meet candidates with RADPAC, and I'll look at the candidate and say, okay, you want to come in here and you want to do all these things and you're going to change the world. And I said, you have no idea what you're getting yourself into, but you did, and you still decided to go for it. Obviously the better part of the work on the Hill outweighed the frustrations that we all have sometimes with things on the Hill and the way it works. Talk a little bit about your decision to do that and kind of the process. And then I want to get a little bit more into Congressman Meehan too, because that's kind of a unique situation.
Yeah, certainly. So when I moved home to help out with my family, I definitely found a different form of public service. Working for my hometown Congressman Marty Meehan, started out as scheduler, eventually worked my way up to become his chief of staff. It was incredibly rewarding. I was able to have a hand in so many different initiatives, both on the policy side, but also, and what often doesn't get talked about, is on the constituent service side. Certainly was able to build, critical contacts with organizations that were focused on making my hometown of Lowell and those surrounding communities better. And so I really loved that form of service. It didn't make me at all regret the fact that I wasn't, far away, negotiating peace treaties, because the work was really rewarding and it was so impactful on individual people's lives and on communities. So I worked for a fair amount of time for him, and it was a great experience. And you asked the question, even knowing that, still running. I didn't have myself running for office, even after working in a congressional office. It really didn't cross my mind that I'd be talking with you today as a member of Congress. I honestly just wanted to build a better life for my family than I had growing up. But things changed, certainly for me. Could pinpoint that to 2016 to 2018. I was doing a lot of work with women trying to ascend in corporate America. And I saw the result of, like, when you had more women around the table, there were better conversations, better decisions, better outcomes. And it was, clear to me that Congress hadn't done its job in terms of electing more women to the body. Not many more were there in 2018 than when I worked there in the 90s. And I felt like that was an important shift that needed to happen in our country. And that really changed things for me. So anyway, when Nikki Tsongas, who was the Congresswoman before me, announced her retirement, which was pretty unexpected, I had this moment of clarity that I can't say I've had too many times in my life. And it really is a gift. I would urge anybody to listen to it if you are lucky enough to have one. I knew I was running for that seat. And, even though there are some things when you are a staffer, you have a very realistic view of what can be changed and what cannot, frankly. There are rules and procedures in the House that inhibit, the pace or at least constrain the pace by which you can operate. I still knew that I had a deep understanding of all that could be done given the constraints. And so we work on that all the time. We operate in a constrained environment, but we've been able to be successful because we know how to build coalitions, how to, reach across the aisle when we need to, how to talk to stakeholders and get a real life perspective and bring that story to folks because it is the most compelling. So I was set up a lot for success because of my time on the Hill as a staffer.
Well, I want to talk about that, but before you do, you mentioned something, or before we do, I want to mention something else that came to mind when you were talking, and I kind of went over pretty quickly, but I think it gets overlooked, and it's so critically important it should not be overlooked. Now, this is a comment that I've been doing this 20 plus years, and Congresswoman Marsha Blackburn, when she was in the House, one time she pulled me aside and she said, "We need more women in Congress." And I said, 100%, I agree. And she said, "You should really feel that way as someone in the healthcare industry." And I said, "Well, why specifically healthcare?" I think we all agree that that's a solid statement that you're making, but why specific to healthcare? She said, 90+% of healthcare decisions are made by women in this country. And she said, think about it from this perspective. She said, "When was the last time your wife told you better make that doctor's appointment?" I said, pretty much every week." And she said, "Now, is your wife helping your parents with some of their hospital doctor appointments?" I said, "Actually, yeah, now that I think of it." She said, "Okay. Now, with your kids, Ted, I know you have 2 kids. Have any of them required any doctor's appointments lately?" "Yeah, of course." "Have you made those appointments?" "No, I haven't." She said, "Who made those appointments?" I said, "My wife did." She goes, "Now you understand what I'm saying." She said, women are such a huge consumer and they understand the healthcare process so much better that having that perspective in Congress is so beneficial. And she really harped on that. It always kind of stuck with me. And you mentioned it too. And boy, is it so true. I mean, we have issues with mammography screening and so many other issues that, a woman understands that otherwise may not. And so I think it's a great point. And I think, it's something that if we can see more of that uptake, that would be so helpful to the healthcare system. Now, we've kind of teased a little bit about your work as a chief of staff on the Hill. Now, even then, when you were chief of staff for Marty, that, things are always toxic. People kind of have this, they romanticize, "Oh, it was never as bad as it is now" type of mentality, but it's always been pretty rough. But your boss, when you were on the Hill, was known as a really good bipartisan legislator, whether it was campaign finance reform or whatever the case may be. So talk about a little bit your experience as a chief of staff and dealing on really high visibility bipartisan legislation. And now as a member, still trying to build those bipartisan relationships, because I think when you have conversations with members of Congress, at least the conversations I have with members of Congress all the time, is that, yeah, it's kind of as bad as it sounds and looks, but it's also not. Like, there's still a lot of really good, cordial conversations and relationships and doing what's best, the best you can most of the time. Obviously, there are certain things that you just, the parties are going to be divided on, but I think it's a little bit better than it's perceived. So I don't know if you want to kind of, that's a
Yeah.
long rambling question, but I'd be curious to get your perspective on that.
Yeah, so when I got to the Hill in 1995, Newt Gingrich also had just become speaker, and so it was an extraordinary time to work through, and one that informs how I even work today, right? Because you're right, there was so much division in the Congress, and it really was sort of the start of this huge rift between Democrats and Republicans, and yet we were able to pass bipartisan, bicameral campaign finance reform. It was like the first major reform or overhaul we had made to our campaign finance laws in decades. And so, it was, of course, that was a long battle. And many times one we didn't know if we could win. But seeing this idea become law, especially, look, Marty dedicated his life and his entire time in Congress to this issue, was truly, it was exciting. And I think that, when you have persistence, when you build a team of talented folks around you who sort of understand your culture of persistence and negotiation, getting to yes, it's you really are a different kind of member. Those bipartisan efforts, they aren't dead today. You're right to point out that there are some issues that are very divisive. They're divisive, across our country, not just in the Congress. And then there are some issues that are, they fall victim to campaign politics. That can be enormously frustrating. But despite all the, the spectacle and the polarization that you see on TV, a lot of our efforts in Congress are bipartisan, including, nearly half of all the legislation that I've introduced since being here. I mean, one of my biggest accomplishments in Congress was the Medication Access and Training Expansion Act, call it the MAID Act for short. And it's bipartisan legislation. It's standardized substance use disorder training to ensure that all prescribers of addictive medications have a baseline knowledge in evidence-based addiction prevention and treatment. And that's because, far too many families here in Massachusetts, across our country, certainly they've lost loved ones because their addiction either went undiagnosed or untreated. So while there's a lot of disagreement and fighting in front of the cameras, lots of these issues, like the opioid epidemic, they affect all of us, regardless of party affiliation. And it's why it's on us as lawmakers to build consensus, to develop, and to be exhaustive about developing bipartisan solutions that actually help the people we represent. And it doesn't often get reported or, take the headlines, but it happens. And it happened during COVID. It continues to happen on the Energy and Commerce Committee. And it's where I focus my time and my effort because, it's sort of how we rebuild the muscle of working together.
Yeah, and it's similar to just your regular local news, right? If you turn on your regular local news, with the exception of sports and weather, and even in where I'm from in Philadelphia, even includes the sports, everything's negative, right? It's like this burglary, this, traffic accident, this bad thing, bad thing, bad thing. It's not like they're sitting there spending 20 minutes reporting all the great things people in the community are doing. They may
Yeah.
do one nice little warm and fuzzy piece for, a minute. And then the rest of the time is, again, going back to the crime and going back to this or that. And so it's there's almost an element of it's just not sexy when it's done right, but it is done right more often, I think, than it's reported. And I think there's a lot of very thoughtful folks like yourself who, hey, look, if I'm going to be away from my kids and I'm going to be spending time away from home and I'm going to be in DC for, 4 days of a week or 5 days of the week, I might as well be productive. I might as well try to get something done and have a little bit of an impact. Otherwise, why am I doing this? Why am I
That's
away from my
exactly right.
family? And I know I'm preaching to the choir on that. So the one thing I want to really stress in this kind of pseudo question next is how important it is, and how, I don't want to say rare, because I think most members of Congress are really trying hard to do this well. But I think you're definitely one of the exceptions in a very good way. And that is having a connection with the value. And maybe this goes back to your staffing days, but having the value towards interactions with constituents. You mentioned it earlier. You've done a great job with our radiology community. You've toured a radiology practice. You've met with our radiologists when they go to Capitol Hill for our Hill Day, and just kind of talk about, again, we have a slide in all of our RADPAC presentations. I think it's like 6% of members of Congress out of the 535 have a healthcare background. So they're not all going to be very educated on healthcare because that's just not their professional background. And why it's important for our constituent membership to get involved with their legislators and educate them on what they feel and what they see every day as clinicians. But talk about your experience with that, because you've been so good to us, and I know you've been equally as good to so many other stakeholder groups on other issues and in other industries. Just talk about the value of that and how it does have some impact with how you're making decisions.
Yeah. So thank you for that. I do consider that a tremendous compliment because we do have a goal in our office of being responsive and accessible, and it's for our benefit. We learn a lot when we meet with families, community groups, practitioners, and frankly, it's the best part of our job. I mean, there's just no better way to get a sense of what's happening on the ground, and how we can best serve folks that we represent than to listen and hear from them. I got to hear from Dr. Neil Madan, the president of the Massachusetts Radiological Society, on your Hill Day earlier this year, and we discussed certainly our shared priorities of making sure that we don't see cuts to Medicare and protecting patients from surprise medical bills. But then I also get to ask questions about what is it like day to day? What is your job like day to day? Where's the friction? Where are the obstacles? And I meet with a lot of groups on a day to day basis. But it is the meeting with Dr. Madan, it stood out because of the remarkable work that radiologists do every time they go to work, and because of the way they're able to convey what they need from us in Congress to support those life-saving efforts. Now, I wouldn't have the ability to just talk freely about that, or in committee, if I didn't go and visit my radiologist at my community hospital. And so, look, it goes both ways. I mean, you said that you're grateful that I take the time to meet, but I'm grateful. I'm grateful to you, Ted, the entire team at the American College of Radiology, and to all the radiologists who show up every day, ready to save lives, and who simply want the resources and the support that they need to continue that work at the highest possible level. So it's sometimes people don't look at Congress or Washington as being sort of a two-way exchange, right? They think that there are folks that are just in a bubble making these policy statements or writing this legislation. And for me, and I think for so many of my colleagues, we're better informed, we're better able to put pen to paper when we've had those interactions, when we've had those tours, when we've talked to people who are actually doing the work, doing the best job that they possibly can, but need more resources or less paperwork or whatever it may be. So I think it's really benefited me as a representative to have those meetings.
It's going to be an interesting fall. As you know, we have some serious issues that you mentioned, a lot of them, and a lot of it hopefully will be taken care of at the end of this year, like it usually is at the end of every year. I was thinking maybe we would get into that a little bit more, but I know we're a little bit short on time, and I want to be respectful of your schedule. But the one thing I feel comfort in is knowing that wherever we are, we have a great advocate in you, and I mean that sincerely. And we need to have more legislators like you who want to be engaged, who aren't afraid to ask hard questions, and or just even ask questions at all.
Yeah.
Sometimes it's you look at, I said 6% of healthcare background in members of Congress. It's very intimidating for the 94% who don't have a healthcare background to say, okay, maybe if I ask this question, is that the right question to ask? And I sound silly. I'm a member of Congress. I don't sound like I know what I'm talking about, or whatever it may be. But for you to be engaged and be willing to interact with our community and so many of the other communities in the healthcare space, it means a lot. And we know that we have a champion in you, and I do appreciate that, and I mean that very, very truly. So, with all that said, we always end our podcasts with what we call a little lightning round of questions. In my mind, before I ask them, I kind of have an idea of what the guests may say, but sometimes I'm very surprised. So we'll go through this pretty quickly. These are like quick replies. Favorite food?
That's easy. Lobster is my favorite food.
Okay.
What did you think I was going to say?
I figured it would be something northeastern. For our listeners who don't know, you're from Massachusetts. You love Maine. Clearly, that's the appropriate answer.
Yeah.
You could have gone a couple other ways, but I figured it would be somewhere in that ballpark. I didn't think it would be cheesesteak. Let's put it that way. That would have been mine. Favorite place to travel? And I may know this one too. I'm not sure.
Oh, that's a tough one. I mean, anywhere new is my favorite place
Okay.
to travel. I'm one of these people who thinks about all the places I haven't been rather than going back to places I've already been. But if I had to say, I haven't seen enough of Portugal. I'm really keen to get there and spend some time there.
Very good. Favorite hobby or activity?
So I've started to enjoy cooking and entertaining with my kids. It used to be a solo sport in my house, but now everyone's joining in, and it makes it much more fun. And the cleanup is distributed evenly. But then when I need to be by myself and sort of recharge, I still run, I still bike, I try to swim. Those are sort of my alone moments where I get to do my best thinking.
Sounds like you're ready to announce your participation in a triathlon or something.
Those are in my rear view, but who knows? Maybe I have another one in me.
And then last one, favorite saying or quote. This could be a really well-known one, a popular one. This could be something that's just unique to you or
Yeah.
in your family.
Yeah, so this one was given to me by, yeah, I guess it's one of my fallback, and I'm not going to get the whole thing right because it's a little bit longer, but I will paraphrase, but it's the Calvin Coolidge quote on persistence, and it starts, nothing in this world can take the place of persistence. He talks about talent and genius and education, but it basically says persistence and determination alone are omnipotent, and the slogan press on has solved and always will solve the problems of the human race. And I know in my personal life and my professional life that persistence has always been what has gotten me positive outcomes and success. I just don't hear no. I just don't even know how to give up. And I think that's something that's well within everyone's control. And it's an attribute that really, can catapult you into, success.
And I think it's great too. We both have kids that are pretty close in age. Mine are slightly older, but it's such a great message for kids because our society is so results focused and results oriented that sometimes they can get hung up on that, especially if they're doing sports and they don't have that great game or that immediate impact from working hard the week before. But just keep on keeping on. I mean, it's really that simple. And that's a really good message. So well, look, I want to thank you for your time. I look forward to seeing you soon. I'm sure, I guess you're back in a couple weeks. We'll run into each other a lot in September. As you know, September is a very busy month on the Hill for a lot of reasons. And so I look forward to us spending more time together. And again, thank you for your time today. I think it's a really good snapshot for our listeners into members of Congress are regular people and they've got regular things that they're worried about just as much as their own constituents are. And what it takes to really make an impact. So thank you.
Thank you, Ted. Thanks for having me, and I'll see you soon.
Take care.